This class is on pregnancy and exercise. Pregnancy is not considered a chronic disease, but it is a special condition and definitely a special population. Of course, the number one thing for exercise during pregnancy is safety. And so it may or may not affect changes that occur during pregnancy. You do have to worry about potential competition for blood flow, substrate availability such as glucose, heat dissipation between the woman and the developing fetus. But in general, exercise is very positive for healthy women. Women who are already active, can usually continue to be active during the course of their pregnancy. Women who are not active can definitely be evaluated to see if they should become active during pregnancy, because you can see there are some health risks associated with remaining physically inactive throughout pregnancy. Particularly excessive weight gain, which then can lead to potential gestational diabetes, and very large babies that can also track to be obese. We'll talk about preeclampsia later. And also, too, poor adjustment to pregnancy body changes. The media really represents pregnant women as, a happy time, and that everybody's very, wanting to love every minute of the changes of their body. And frankly, a lot of women are not comfortable with the changes that occur in their body. So you have to keep that in mind. This slide is from the new ACSM guidelines book. So relative contraindications. So this means that, they could potentially affect somebody's ability to exercise. So it's not an all-out, be-out ban, but these things should be taken into consideration. So all of these can be factors in deciding whether a woman can exercise during pregnancy. I'm not going to read the list here. You can see them pretty clearly on the screen. Now, if you look at the next screen, and you can see that there are definitely some reasons why women should not exercise. Absolute means exercise is off the table. Incompetent cervix. So the cervix is not, there's a chance of the baby preterm labor, multiple gestation. So women who have triplets, twins, triplets, they can be at risk for premature labor. Placenta previa is a condition where the placenta is not quite in the right place. So that can also be a factor. And we'll talk more about preeclampsia later. Body weight and body composition. Most women are going to see increases in their first and second trimesters, increased fat deposits. On the other hand, if a woman is experiencing severe morning sickness, nausea, she may actually lose weight during the first trimester, and some women experience morning sickness well into the second trimester. So the amount of weight gain can be an issue for some women. An extra 300 calories a day is needed after the second trimester for the developing baby. So it's not a whole lot. So you can see where it is very easy to eat more than that. In a typical weight gain of 25 to 30 pounds, you can look on the slide and see the breakdown. So an average baby is about 8 pounds. And what are some of the other fluids and fat gain during pregnancy?